Testing DIP flexion, you'll have your patient's hand on a flat surface or table as shown here. First thing you'll have your patient do is perform a bear claw with her fingers. Because she's able to perform this full range of motion, that is a grade 3. To test for a grade 4 or 5, I will stabilize the PIP and the MC joints by making sure they don't move and only the DIP joint can move. So go about halfway with this DIP. I'm going to apply resistance. 3, 2, 1, 3, 2, 1, 3, 2, 1, and at the pinky, 3, 2, 1. Let me stabilize that better. 3, 2, 1. If she's not able to perform any range of motion in this position with the DIP joints, I can have her in a gravity eliminated position, as shown here. If the DIP joint is a small joint though, so to test for a 2 in this position, I'll just leave that up to you. It's just not a lot of weight. If you do not see any range of motion happening at the DIP joint in this position, you can palpate for the flexor digitorum profundus at the middle phalanx, right here, and right here. If you feel that muscle firing, that is a grade 1, and if you do not feel it firing, that is a grade 0.